3 years before I ever considered writing or speaking publicly about medicine, I performed a surgery that I still think about almost every week. The patient was a 69-year-old man named Thomas. Retired civil engineer, meticulous by nature, the kind of man who kept a notebook in his shirt pocket and wrote things down before he forgot them. His wife told me that on the morning of his surgery, he had made a list of questions to ask me afterward. He was already planning the conversation we would have on the other side of the operating table. When I opened his chest, what I found stopped me for just a moment. His arteries did not look like arteries. They looked like old plumbing from a house built before the war. Rigid, calcified, narrowed to a fraction of what they should have been. He was on 5 medications, 5 separate prescriptions, taken faithfully every morning without exception. His wife confirmed it. He never missed a dose. He exercised when he could. He went to every appointment. He did everything that had been asked of him. And still, his cardiovascular system had quietly been deteriorating for years while nobody looked closely at what was happening between the prescriptions in the kitchen, at the dinner table, in the pantry, in the small, invisible daily decisions that medicine rarely has time to address in a 15-minute appointment. After the surgery, when Thomas was stable and we finally had that conversation he had been planning, the one he had written questions for in his little notebook, the thing he said that I have never been able to set aside was this. He looked at me and said, "I followed every instruction. Why wasn't this enough?" I did not have a complete answer for him that day. But over the years that followed, as I went deeper into the research on vascular inflammation, on dietary biochemistry, on the mechanisms behind arterial stiffening, I began to understand that the instructions he had been given, while not wrong, were profoundly incomplete, and that the missing pieces were not complicated. They were not expensive. They were not even particularly difficult to incorporate. They were simply never explained. This is what I want to talk about today. Not to replace medication, not to suggest that pharmaceuticals are the enemy, but to fill in what gets left out. 5 specific, evidence-supported changes that work directly on the biological processes driving blood pressure in an aging body. Starting tonight, with whatever is already in your kitchen. To understand why these 5 things matter, you first need to understand what is actually happening inside your blood vessels as the decades pass. Most people think of high blood pressure as a plumbing problem, too much pressure through fixed pipes. But that framing misses the most important part. The pipes themselves are changing. When you're young, your blood vessels are elastic. They expand and contract with every heartbeat, absorbing the pressure, distributing the force, working in harmony with a heart that does not have to fight its own infrastructure. As you age, the walls of those vessels begin to lose their elasticity. A protein called elastin, which gives vessel walls their flexibility, gradually breaks down. Another protein called collagen, which is stiffer and more rigid, begins to dominate the structure. The vessel walls thicken. They stiffen. And a stiff vessel cannot do what a flexible one does, which means the heart must work harder to move the same volume of blood through a system that is actively resisting it. This process is not inevitable in the way gravity is inevitable. It is accelerated dramatically by something that most patients have never had clearly explained to them: chronic low-grade inflammation in the walls of the blood vessels themselves. You cannot feel it. It produces no obvious symptoms in its early stages. But day after day, year after year, it quietly hardens and narrows those vessels, drives up pressure, and eventually creates the kind of arteries I found in Thomas's chest. Here is the part that matters most for everything that follows. What you eat 3 times a day is either feeding that inflammatory process or working against it. Every single meal is a biological event with a direct consequence for your vascular health. That is not a metaphor. That is physiology. And understanding it changes how you think about food entirely. The first thing I want to talk about is so simple that most people dismiss it immediately, which is precisely why it so rarely gets tried. The sequence in which you eat your food at each meal has a measurable and significant effect on your post-meal blood pressure. Here is what happens. When you begin a meal with refined carbohydrates, bread, rice, pasta, crackers, the starches are broken down rapidly and absorbed into your bloodstream as sugar. Your blood glucose climbs sharply. Your pancreas responds by releasing a surge of insulin to bring that glucose into your cells. And that insulin surge, that spike and the vascular response it triggers, causes your blood vessels to constrict. Right there at the dinner table, without you feeling anything, your blood pressure is going up. Now, change only the sequence. Begin every meal with your vegetables. All of them, before anything else on the plate. The fiber in those vegetables forms a physical matrix in your digestive tract, a kind of gel layer that slows the absorption of everything that comes after it. The same carbohydrates, eaten after that fiber layer is in place, produce a dramatically blunted glucose spike. Less glucose spike means less insulin surge. Less insulin surge means less vascular constriction. Less constriction means lower post-meal blood pressure. I have had patients who changed nothing else. Not the food, not the portions, not the timing, not the medications. Only the sequence. Vegetables first, then protein, then carbohydrates last. And their post-meal blood pressure readings dropped meaningfully within 2 to 3 weeks. One patient, a retired school principal in her early 70s, described it as the quietest health intervention she had ever made. She barely noticed she was doing it, and yet her numbers shifted in a direction they had not moved in years. The second change involves something that has likely been sitting and used in your pantry for months. Apple cider vinegar is one of those substances that has spent decades trapped between folk remedy territory and mainstream medicine, never quite landing on either side. But the research behind its specific mechanism of action on blood pressure is genuine and worth understanding clearly. The active compound in apple cider vinegar is acetic acid. Acetic acid does two things that are directly relevant to blood pressure regulation. The first is that it improves the sensitivity of your cells to insulin. When your cells respond to insulin more efficiently, your body requires less of it to manage the same glucose load. Less insulin in the bloodstream means less of the vascular constriction effect we just discussed. The spike is blunted. The pressure response is reduced. The second mechanism is more striking. Acetic acid has been shown in multiple studies to stimulate the production of nitric oxide in the walls of blood vessels. Nitric oxide is your body's own vasodilator. It is the signal that tells smooth muscle in your arterial walls to relax and open up. It is essentially the mechanism that an entire category of blood pressure medications tries to replicate pharmaceutically. And here it is, available naturally for the cost of a few dollars a month. 1 to 2 tablespoons diluted in a full glass of water with each meal. That is the protocol. Never drink it undiluted, because concentrated acetic acid can damage tooth enamel and irritate the lining of the esophagus. Use a straw when possible. And if you have a history of acid reflux or stomach ulcers, have a conversation with your physician before incorporating this regularly. But for the majority of people over 60 with no contraindications, this is one of the simplest and most accessible tools available. The third area I want to address involves something most people have never considered: what is happening to your blood pressure while you are asleep. Most people measure their blood pressure in the morning and assume that reading represents a complete picture. It does not. In a well-functioning cardiovascular system, blood pressure drops naturally during sleep, giving the heart a period of reduced demand, allowing vessels to rest. In a significant portion of people over 60, this does not happen. Pressure either stays elevated through the night or spikes in the early morning hours. This is sometimes called nocturnal hypertension, and it is one of the most underdiagnosed patterns in cardiovascular medicine because your daytime readings will not reveal it. You can have perfectly acceptable morning numbers and still be experiencing dangerous pressure elevations every night for hours while you sleep. This is where a very specific pre-sleep habit becomes relevant. Approximately 30 grams of walnuts, which is roughly 14 halves, eaten about 30 minutes before bed, has been shown across multiple studies to meaningfully support the natural nighttime pressure reduction that should occur during sleep. The mechanism involves 3 compounds working in combination. Walnuts are among the richest plant sources of alpha-linolenic acid, a plant-based omega-3 fatty acid that directly reduces vascular inflammation and supports arterial flexibility. They also contain meaningful amounts of melatonin, which supports the circadian signaling that governs nighttime blood pressure behavior. And they contain an amino acid called L-arginine, which is a precursor to the same nitric oxide we discussed earlier, the signal that relaxes vessel walls. Together, these compounds send a specific biological message to the cardiovascular system. The day is ending, pressure should fall, the heart can rest. 30 grams, 14 halves, 30 minutes before sleep. That is the entire protocol. The fourth change involves a plant that has been used medicinally across 3 continents for centuries and that modern cardiology has only relatively recently begun to study with the rigor it deserves. Hibiscus, the deep crimson flower known across different cultures as sorrel, carcade, and red tea, has a pharmacological profile that is genuinely impressive. The active compounds in hibiscus flowers, a class of pigments called anthocyanins, along with specific organic acids unique to the plant, act on the cardiovascular system through a mechanism that closely mirrors one of the most widely prescribed categories of blood pressure medication in the world. These medications, known as ACE inhibitors, work by blocking an enzyme that causes blood vessels to constrict. They are effective, commonly used, and in many patients absolutely necessary. Hibiscus works through the same pathway, inhibiting the same enzyme, producing the same relaxation of vessel walls, without the persistent dry cough that causes a significant percentage of patients to discontinue ACE inhibitor therapy. A well-designed clinical trial published in a major nutrition journal found that daily consumption of hibiscus tea reduced systolic blood pressure by an average of 7 points in participants with mildly to moderately elevated readings. 7 points is not a trivial reduction. That is the magnitude of effect that changes clinical decisions. 3 cups daily, hot or cold, with minimal or no added sugar, since sugar actively works against everything these compounds are trying to accomplish. A small amount of honey is perfectly acceptable if you need it. Morning, midday, and evening. It is a ritual that is genuinely pleasant, and your vascular system will register the difference. One important caution. If you're already taking an ACE inhibitor medication prescribed by your physician, please discuss hibiscus tea with them before adding it regularly to your routine. The combination can push blood pressure lower than intended, and balance is the goal, not overcorrection. The fifth change is the one I feel most urgency about communicating clearly, because it involves something that has been embedded in the food supply and in mainstream dietary advice for decades, and that the science has now definitively moved away from. Go to your kitchen cupboard right now, or think about what is in it. If you're like the majority of households, you have at least 1 bottle of canola oil, soybean oil, sunflower oil, or corn oil. These oils are everywhere. They are marketed as heart-healthy. They are used in virtually every processed food on the market. And they are, for your blood vessels and your blood pressure, among the most problematic substances in the modern diet. Here's why. These oils are extraordinarily high in omega-6 fatty acids. Omega-6 is not inherently harmful. Your body requires some of it. The problem is ratio. For the vast majority of human history, people consumed omega-3 and omega-6 fatty acids in roughly equal proportions. Today, the typical diet delivers 15 to 20 times more omega-6 than omega-3. That extreme imbalance is one of the primary biological drivers of the chronic systemic inflammation we discussed at the beginning. The inflammation that stiffens arteries. The inflammation that drives blood pressure upward year after year. Every meal cooked in these refined seed oils is adding fuel to that fire. But the problem does not stop at the omega-6 imbalance. These oils are chemically unstable at cooking temperatures. When heated, they oxidize rapidly and break down into compounds called aldehydes, which are directly toxic to the cells lining your blood vessels. The food looks the same. It tastes the same. The damage is invisible, but it accumulates with every meal over years and decades. The replacement is straightforward. Extra virgin olive oil for anything that does not require very high heat. Salads, light sautéing, finishing dishes drizzling. Extra virgin olive oil is rich in a natural anti-inflammatory compound called oleocanthal and in monounsaturated fats that actively support healthy arterial function. The research supporting its cardiovascular benefits is among the most consistent and extensive in nutritional science. For higher heat cooking, the evidence now points clearly toward real butter, not margarine, not vegetable oil-based spreads, but traditional butter, ideally from pasture-raised animals. Margarine is manufactured from the same refined seed oils we are trying to eliminate. The advice to replace butter with vegetable oil spreads, which was dominant for decades, was based on research that has since been substantially revised. As someone who has operated on thousands of hearts and examined the arterial damage that accumulates over a lifetime of dietary choices, I can tell you that the science has moved, and the direction it has moved is away from refined seed oils and toward traditional fats used in reasonable amounts. You do not need to throw away what is currently in your cupboard. Simply stop replacing it when it runs out. Buy extra virgin olive oil next time. Use real butter for cooking when temperatures are high. That transition, made gradually over the next few months, will produce measurable changes in your inflammatory markers over time, and those changes will show up in your blood pressure readings. Now, I want to address something directly because I know it is sitting in the minds of many people listening to this. When you hear 5 simple food-based strategies for blood pressure, a part of your brain immediately generates a reasonable objection. If these things actually worked, my doctor would have told me about them. I understand that reaction. I had a version of it myself early in my training. But here is what 30 years of cardiac surgery has taught me. The most powerful interventions are almost never the most technically complex ones. And the gap between what research demonstrates and what gets communicated in a standard medical appointment is enormous. Not because physicians are withholding information, but because a 15-minute consultation simply cannot cover everything, and the incentive structures of modern healthcare are not designed to prioritize time spent discussing food. What is remarkable about these 5 strategies is that they all work through the same underlying mechanism. Every single one of them addresses vascular inflammation and arterial flexibility. The vegetable sequencing reduces the insulin-driven constriction response. The apple cider vinegar blunts glucose spikes and stimulates nitric oxide production. The pre-sleep walnuts support the natural nighttime pressure reduction and reduce inflammatory signals in vessel walls. The hibiscus tea inhibits the enzyme that causes vascular constriction. The oil replacement removes one of the primary inflammatory fuels from the daily diet. 5 different approaches, 1 biological target. And that convergence is not a coincidence. It is a picture of how the body actually works. Thomas came back to see me 8 months after his surgery. He had been working with his cardiologist on everything we had discussed, implementing each of these changes slowly and deliberately, one at a time, in conversation with his medical team. When he walked into my office, I noticed before he said a word that he moved differently. He sat down, opened his notebook, and told me that his cardiologist had been able to reduce his medications from 5 to 3. His inflammatory markers had dropped to the lowest levels recorded in his chart. His pressure had been stable for 4 consecutive months. He tapped his notebook and said, "I wrote down the date I started each one. I wanted to know which made the difference." I told him they all did, because they were all working on the same thing from different angles. He thought about that for a moment, and then said something I want you to carry with you. He said, "I spent 20 years managing my blood pressure. I think I've only just started treating it." That distinction matters. Managing a condition means containing it. Treating it means changing the conditions that allow it to persist. Food, used deliberately and consistently, is one of the most powerful tools for changing those conditions that medicine has ever identified, not instead of your medication. Alongside it, as a partner to it, as the part of the conversation that too often gets left out. Pick one of these 5 things tonight. Just one, whichever feels most accessible, most natural, most doable given what is already in your kitchen. Start there. Do it consistently for 3 weeks before adding anything else. Sustainable change does not come from overhauling everything simultaneously and abandoning it all by the end of the month. It comes from one decision, repeated until it becomes invisible, until it is simply the way you live. Your blood vessels are not fixed structures. They're living tissue, responsive to the environment you create for them. Give them less inflammation, more nitric oxide, better insulin signaling, and the right fats, and they will respond. The research says so. The patients I have seen make these changes say so. And somewhere in a notebook in a retired engineer's front pocket, the dates written down carefully in his own handwriting say so too. Everything shared here is based on published research and clinical experience and is intended as general health information, not personal medical advice. Please do not adjust or discontinue any prescribed medication without a thorough conversation with your physician. Bring these ideas to your next appointment. Ask the questions. Your medical team is your partner in this, and these strategies work best when they are part of a complete, supervised approach to your health.